you wanted the best, you've got the best podcast. The hottest podcast in the world. The Chris Voss Show, the preeminent podcast with guests so smart you may experience serious brain bleed. The CEOs, authors, thought leaders, visionaries, and motivators. Get ready. Strap yourself in. Keep your hands, arms, and legs inside the vehicle at all times, because you're about to go on a monster education roller coaster with your brain. Now, here's your host, Chris Voss.
Hey folks, it's Voss here from TheChrisVossShow.com. With our lacings that makes it official. Welcome to the big show. As always, the Chris Voss Show is a family that loves you, but doesn't judge you at least not as harshly as the rest of your family. For over 16 years, 2,500 episodes, one of the top 100 podcasts in the world. We've been bringing you the most amazing shows and everything else. Go to and refer your friends and family to Facebook.com/Chris Voss, YouTube.com/Chris Voss, Chris Voss 1, the TikTokity, and all those crazy places on the internet.
Opinions expressed by guests on the podcast are solely their own and do not necessarily reflect the opinions of the host or the Chris Voss Show. Some guests of the show may be advertising on the podcast, but it is not an endorsement or review of any kind.
Today's featured author comes to us from bookstolifemarketing.co.uk. With expert publishing to strategic marketing, they help authors reach their audience and maximize their book success. Today, an amazing young man on the show, Dr. Ira Williams, joins us, and his latest book is called Healthcare Warriors: Why and How to Become One, out October 1st, 2022. We're going to get into it with him and find out more about his writing, his research, and knowledge. He's written 5 books on the healthcare system and 1 Christian book. So he's quite prolific in what's going on with our healthcare system. And we're going to chat about that today. His folks that appeal that are interested in him usually are interested in creating a healthcare advocates group where they live, and also he speaks and trains and all that sort of good stuff. So let's get in with him. Welcome to the show, Dr. Williams. How are you?
Doing great, Chris. And thank you for having me on Veterans Day.
Thank you for coming. And congratulations. I don't know if congratulations is the right word, but thank you for being a veteran. We certainly appreciate it.
I owe a lot to the Air Force.
Well, we owe a lot to you, the defenders of our freedom and our democracy, at least when we had one. Jokes in 2025. Dr. Ira Williams is a board-certified oral surgeon. In writing his books on healthcare, has been recognized why the current healthcare system is broken and how to begin to create a far better system. So, Dr. Williams, give us your .coms, any websites you want people to get to know you better.
Yeah, just my name, drirawilliams.com.
Mm-hmm. And anything else? Any other .coms?
No, just the one.
All right. So give us a 30,000 overview of what's inside your book that we have here.
I come from inside the system, and even though my degree is DDS, I graduated from the University of Tennessee Dental School in 1961. I took an internship in a 3-year oral surgery residency and became a board-certified oral and maxillofacial surgeon and anesthesiologist, and I practiced over 20 years in Madison, Wisconsin. Mm-hmm. And during my second year of my residency, I performed 35 autopsies.
Wow.
And so I have extensive experience within the system. And unfortunately, while practicing in Madison in 1979, I was asked to be the second surgeon to correct negligent care of a middle-aged woman for a simple fracture of the lower jaw.
Oh, wow.
By not one, but 2 ENT surgeons who happened to be brothers for 4 months. And after correcting the surgery and helping her get a satisfactory healing, she and her husband wanted to sue the doctors because their mismanagement had gone on for 4 months. And when I saw her, she was worse off than the first day she fractured her jaw. Mm-hmm. And I had to make a Damascus Road decision. Would I testify as the second surgeon in the city in which I practiced? And I came to the conclusion, and this I talk about in my Christian book, Saul to Paul to Luther, that it was like a Damascus Road event for me. If I felt if I didn't testify for her, I would have to sell my soul.
Is that what a Damascus, what do you call it again? Give us a definition for that so we have foundation.
Well, when Saul was on the road to Damascus and Jesus spoke to him, and he was going to Damascus to assault believers of Jesus. And Jesus spoke to him and said, Saul, why are you persecuting my people?
Yeah, Saul, what's up with that, buddy?
And he suddenly flipped and became the Paul that we know in the New Testament. So I was left with a dilemma. Should I testify against fellow surgeons in the city in which I practice? And again, I felt like if I didn't, I would have to sell my soul. A few years later, I would go on to be the second surgeon and end up testifying against MD surgeons in all three private hospitals over a span of about 5-6 years. And because I broke the code of silence, the medical community economically ran me out of town.
Oh, wow.
And so I relocated to Greenville, South Carolina. And after several years, I wondered if I could write a book. And I wrote my first book. I published it in early 2004, and it was about medical malpractice.
And what was it entitled, so people have a reference?
First Do No Harm, The Cure for Medical Malpractice. And I consider myself a non-legal expert on medical, dental, surgical malpractice. Because I continue to act as an expert witness in other states and other cases. And only 8 years ago, I was a successful expert witness for a young Muslim attorney in Orange County, California, and his attorney. Ali had been harmed by an MD DDS oral surgeon, greatly harmed. And Ali had contacted me in 2014 and sent all his records. And I reviewed them, and I said, yes, I would act as your expert witness. And they decided not to fly me out to California to meet them. And so nothing was going on for 3 years. And finally, they called me in a panic in 2017 and said, the defense attorney had gone to the judge and said, well, they have offered no evidence that my client did malpractice. So the judge called Ali's attorney and said, you've got to give me something real quick, or I'll have to dismiss the case. So they called me in a panic and they said, I forget now, I only had a week or 10 days to create a declaration outlining the reasons why I could demonstrate the surgical malpractice of the surgeon. So I created a 7 legal page declaration that covered every point on how that surgeon had harmed his Ali. And I sent it to them, and 2 or 3 weeks later, they called me with great joy. The other team had folded their tent, settled fully, and unfortunately, California had the limitation at $250,000. And this had been going on for 3 years, so the attorney had to get his part, and Ali had to pay another surgeon to correct him. So they said they could only send me $5,000 for what I'd done for them.
So give us an overview of what you hope to achieve with Healthcare Warriors. We've had a lot of conversations on the show over the years with many doctors, probably hundreds, about advocating for yourself in healthcare or advocating for loved ones that you may be taking care of in healthcare. Why is it important to become a healthcare warrior? And what kind of sword do I need and shield?
Okay. What I try to help people understand when we talk about the healthcare system is broken, I believe I am the only healthcare expert, and I say this on my website. I know why the current system is broken. I know how the current system is broken. More importantly, I know how to begin to create a better system. And I said that in Medicare, Medicaid headquarters 5.5 years ago, when I met with the chief of the medical staff and 3 of her deputy chiefs for an hour. And yet 5.5 years later, they've never got back to me for more details. But the more important thing, Chris, is that I try to personalize it. Okay. My subject is your and your loved one's healthcare system. And so when I say it's broken, I'm talking about the system that's going to reach out and grab you sooner or later.
Yeah.
And it's going to reach out and grab everyone you hold near and dear to your heart. And while experts have been saying the system is broken for the last 4 decades, I want to give you my assessment of the current healthcare system.
Okay.
Becoming a patient in any hospital in America is like shooting craps in Las Vegas. Not everybody comes out a winner, and I've shot craps in Las Vegas and the French Riviera and several other places here and abroad. And trust me, becoming a patient in any hospital in America is like shooting craps in Las Vegas.
You're too true there, right? Yeah, you definitely are on point with that.
Yeah, but what people don't realize is healthcare experts have been promising to improve the quality of care and patient safety for decades, and it's no better now than it was years ago.
Yeah.
I assume you recognize the name Dr. Marty McCary.
No, I don't.
The president made him head of the Federal Drug Administration. He's one of the 4 healthcare experts the president has working to improve our healthcare system. He's written 4 books. And his first book, published in mid-November 2012, focused on hospital medical staffs and teaching hospitals. And his one-word title speaks volumes. The one-word title is unaccountable. And then in 2016, he and a co-author published a paper that estimated that medical errors or needless hospital deaths are the 3rd leading cause of deaths behind heart disease and cancer in the U.S. And not an eye blinked in Washington, D.C., and not an eye blinked in any of the 50 state capitals. I don't understand that.
Well, it's the hospital medical business is hard to understand.
I can help people understand it, and I'm looking for opportunities to speak to live audiences.
Okay.
I can begin to tell people how they can begin to better understand the healthcare system. And earlier, before you started the program, you mentioned something about your insurances coming up. It is going up.
The ACA.
All right. The first thing you have to understand about healthcare is you have to completely separate how to pay for healthcare from what I call the healthcare delivery system, doctors, hospitals, and surgery centers. You can't mix the two. And so why you and many others across the country are naturally worried about the cost of healthcare, my expertise deals with the delivery system. And that's what I call real healthcare. And that's where the healthcare rubber meets the road. And yet you don't hear many people talking about that aspect of healthcare. ever since Lyndon Johnson created Medicare and Medicaid, the overwhelming focus has been on how to pay for health care. And while I agree you got to pay for it, it's a service, but real health care takes place in doctors' offices, in hospitals, and in surgery centers.
Yeah, most definitely. Most definitely. What are some tips that you give people to advocate for themselves as a healthcare warrior?
Well, what I'd like to do is I have 2 presentations that I would like to give at near the same time, but separate times, to help people begin to gain understanding of the delivery system. And since, like I say, that is a part of the system that's going to reach out and grab you. And to give you an idea, today is the first day in the rest of your life. So what do you think is the potential that someday in the future you'll be a patient in a hospital?
Pretty much 100%, right?
Yeah, pretty big.
I mean, you live long enough.
And like I say, experts have been saying for decades, the system's broken, but nobody wants to tell in detail why it's broken, how it's broken, or how to begin to create a better system. And I can do that.
Well, this is something you've spent 4 decades studying and learning about. You want to touch on some of the other books you wrote so we can tease them out as well?
My books demonstrate the decades-long process of my gaining greater insight in the system and how and why it fails, why it is far less effective than it should be. And so each of those books convey different aspects of my process of getting where I am today. Since my first book 21 years ago was on medical malpractice, which I knew well, I was then led into feeling a need to really study the system. And so I've been going to DC and I've been going to all-day meetings with some of the academies, and I've been studying it at the state level. And over the past 20 years, I feel I've come to have as profound an understanding of the delivery system as anyone in America.
Well, that's good to have. And people can hire you to speak. Do you do any consulting or coaching one-on-one, or maybe to groups?
I'm available. And let me give you a couple of offers. There different experts will have different views. And one of my offers is I would share a stage with any other healthcare expert in the nation before a live audience if they might have different views. And I think such an event would provide the audience with a lot of insight into healthcare. So what I'm trying to do is entice more open debate, more discussion about the delivery system, since how to pay for it gets overwhelming attention. I'm trying to get more open public discussion about doctors and hospitals and surgery centers, and I can do that.
Well, advocating for your health is really important. The healthcare system is definitely crazy and stuff right now. Can individuals, there's a lot of this in the healthcare system. There's a lot of monopolies. Like, for example, my one of my relatives lives in a state, and she really can't. She's retired, and she really can't move from there because she's kind of landlocked by her insurance. Her insurance is in that state, and she retired under that insurance. And so it's really hard for her to move around. There's these monopolies that are in every state of different, 1 or 2 major healthcare systems. How can people advocate? How can people get change to happen to the system? Do we all have to get together and harass our politicians and vote, or what has to happen for us to get the healthcare business improved, or can individuals influence?
Well, to speak to that point about that person, if people will listen to what the Republicans are trying to offer, one of the things is to have insurance cross state lines. But again, I don't go into any aspect of how to pay for health care or insurance.
Okay.
I have no qualifications for that. My focus is strictly on where the rubber meets the road.
Yeah.
Doctors' offices, hospitals, and surgery centers. And to give you another offer, and this is for every governor out there. If any governor invites me to come into his state capital, I can go into that. Each capital city probably has a flagship medical center. I can go into that medical center, or I can go into any hospital in the nation, and in less than half a day, I can identify and demonstrate probably at least 3 different forms of unethical, unprofessional behavior.
Wow. That's crazy.
I doubt that any governor will ever accept my invitation to show them what really goes on in their hospitals.
I think you should maybe you should do random audits. You should be one of those people that, sneak into places and figure that all out and then expose it. I don't know. Maybe that would be a TV show or something like that.
Well, yeah, but see, the governor would have to give you what I refer to as delegated authority in order to be able to do that. Now, in my Air Force career, I'm a senior navigator, bombardier, squadron commander, and summary court-martial officer. I was commissioned in 1954 in April, got my wings in June as a navigator. In July, celebrated my 21st birthday, and in early August, I was in South Korea training as a bombardier on medium bombers that had been used in the Korean War. And 6 weeks after I arrived there, a roommate and 3 others were killed in a combat training mission. And I came to realize that becoming combat ready in any type aircraft is not like a walk in the park.
Yeah, definitely not.
But see, as a squadron commander, I was delegated authority by a higher source of authority. In this case, the deputy wing commander. Well, if a governor would like to know the truth about what's going on in the hospitals in their states, they would have to delegate sufficient authority to me to allow me to go into a hospital and without disrupting normal daily activity. I've been on the hospital medical staff of several hospitals. I would never do that. I can easily identify and demonstrate what truly goes on and should not go on in probably every hospital medical staff in the nation.
Maybe you could do it as a consultant. Would the hospitals hire you as a consultant, or they want to avoid any accountability?
That's the last thing the hospitals or the hospital associations want.
Yeah. People can read your book and advocate for themselves. That's really important. As we go out, final thoughts and stuff you want people to learn from your books and things.
Well, I hope they will contact me through my website. Again, I'm looking for opportunities to speak to live audiences. There are 4 people here in South Carolina who are with elected higher level positions who have refused to help me in any way. I can give President Trump 2 different things that would help him immediately, and neither Trey Gowdy or Senator Scott or my current Congressman William Timmons or our Lieutenant Governor Pam Evitt will help me in any way to connect with the White House. And if I could get connected with the White House, I have two things that immediately would help with what the president's trying to do to better this country.
Oh,
And,
well,
and the strange thing is those four people won't tell me why they won't help me.
yeah. Well, I mean, there's a lot of money and lobbyists that the medical community has, and they lobby the crap out of and buy all congressmen. Really, I mean, it's not party related. They're all in the thing, thanks to Citizens United ruling from SCOTUS.
Well,
Just by a politician.
I'm trying to wake up people.
Yeah.
To make them understand just what I told you. My subject is your and your loved one's healthcare system.
Mm-hmm.
And people, I can help people gain a better understanding of that so that they can be equipped sufficiently to start asking their governors and their legislators, why aren't they trying to make the system in their state better?
There you go.
And Healthcare Warriors was written as a target audience for people in any state who would like to begin to create a grassroots group to focus on health, like MAD, Mothers Against Drunk Driving. Mm-hmm. We need people to begin to create grassroots group like MAD, focus on healthcare, and have them invite me to come show them how to really get organized so they can become effective where they live.
So give us .coms. Where can people find you on the interwebs to reach out to you, contact you, etc.?
DrIraWilliams.com.
Well, thank you, Ira, for coming on the show. We really appreciate it. Thank you.
Hey, I appreciate it.
And thanks to Ronitz for tuning in. Order up his book wherever fine books are sold. You can read more about it. Healthcare Warriors, Why and How to Become One. Check out some of his other books. The Solution No One Else is Talking About. Find the Black Box, How to Prevent Needless Hospital Deaths. Thanks, Ira, for coming on the show. Thanks to Ronitz for tuning in. Go to goodreads.com/Chris Voss, linkedin.com/Chris Voss, Chris Voss 1 on the TikTok and all those crazy places on the internet. Be good to each other. Stay safe. We'll see you guys next time.
Thanks.